Good morning, my name is Rebecca and I'm going to be your nurse today. How are you?
I'm doing good.
Good. Alright, can I get you to just verify your name for me?
Dora Guerra,
Okay, Miss Dora, and how old are you?
52.
Alrighty. Now, Miss Dora, you are in here today for a general survey, so it's just going to be an assessment of your head and neck. Is that okay?
Sure.
Okay. And if at any time during the assessment you feel uncomfortable or in any pain, just let me know, okay?
Okay.
So I'm going to begin by just asking you a few questions. You've already told me your name and your age. Do you know who the president is?
Trump.
Okay, very good. And do you know who the former president is?
Biden.
Very good. And do you know what day of the week it is?
Monday.
Okay. Alright, Ms. Dora. So your BMI, which is your body mass index, is appropriate for your height and weight. So that is good, okay?
Mm-hmm.
I noticed when you walked in, your mobility was nice and straight. I didn't notice any use of a cane or a walker. Do you use any of those?
No, I don't.
Okay. And what about I didn't notice any physical deformities. Do you have any of those?
No.
Okay. And your posture is nice and straight. Your clothing is nice and clean, so it does show that you have good personal hygiene. Okay. Would you say that your English is your primary language?
Yes.
Okay, very good. And what about your mood? Would you say your mood is happy today?
Yes.
Okay. And would you say this is a normal for you?
Sure.
Okay, very good. All right, Ms. Dora. So I'm going to go ahead and get my hands clean, and we're going to begin on the assessment part, okay? Okay. So if at any time, like I said, if at any time you feel uncomfortable or any pain, just let me know.
Correct.
Okay, so we're going to begin by assessing your cranium, which is your head. I'm just going to be looking for any lumps, bumps, or bruises. I'm just going to be feeling for any lumps, bumps, or bruises. I'm going to be looking at the shape of your head. It's round and symmetrical. I do not feel any lumps, bumps, or bruises. I'm going to be looking at your scalp, looking for any redness, flakiness, or signs of infestation. I do not see any. Your hair is thin, dark brown, and evenly distributed. Okay. Very good. Alrighty, Ms. Doris, when I press on your head, do you feel any tenderness at all?
No.
Okay, very good. Okay. So, Ms. Dora, I'm going to move down to your eyes. Okay. I'm just going to be looking at your eyebrows, and they are symmetrical. Can I get you to close your eyes for me? Your eyelids, your eyelashes are all symmetrical. Go ahead and open your eyes. Your eyes themselves are symmetrical. I do not notice any redness, swelling, or discharge. Okay. Now, Ms. Dora, I have a pen light right here. I'm going to get you just to look straight at me, and I'm going to shine some light in your eyes, okay? Very good. All right, Ms. Dora, can you look at my pen light? Okay, then I'll get you to look at the wall behind me, and then look back at my pen light. Very good. So your eyes are equal, they're round, they're reactive to light and accommodation, so that is good, okay? I'm going to go ahead and press on your sinuses. Let me know if you have any tenderness, okay? These are your frontal sinuses, and these are your maxillary sinuses. Do you have any tenderness?
No.
Okay, very good. Alrighty, so then from there I'm just going to be looking at your nose. I'm looking for any redness, swelling, or discharge. I do not see any. Your nose is symmetrical. I'm going to be looking at your ears. They look symmetrical. No redness, swelling, or discharge noted. Do you have any tenderness when I press on your ears?
No.
Oh, okay, very good. From there, I'm going to move down to your lips. Your ears are symmetrical, and then I'm going to move down to your lips. Your lips are symmetrical. They're pink and moist. No cracks or lesions present, okay? From there, I'm going to go ahead and move down to your neck. On your neck, I'm just looking for any lumps, bumps, or bruises, or visible pulsations present. I do not see any. I'm going to be looking at your trachea. Your trachea is nice and midline. Okay, very good. Alright, so I'm going to begin by assessing your lymph nodes. So for your lymph nodes, I'm just going to be rolling my fingers over them and calling them out as I go, okay? So we're going to start off with your preauriculars, right here in the front of your ears. Okay, and then your postauriculars that are behind your ears. Very good. Okay. And then we're going to go ahead and go on over your occipital. That's going to be right here behind your head, behind your neck. in the back area, okay?
Okay.
Okay. Alright, Ms. Doris, I'm gonna fill over these are just the digastric lymph nodes. These are gonna be what you would consider your tonsils. Your submandibular is gonna be right here underneath your chin. Very good. And then your submental is gonna be right here in the middle.
Mm-hmm.
Okay. From there I'm gonna move down your neck. Okay. We're gonna start off with the posterior cervical. Okay. Superficial cervical. Just gonna go from the top to the bottom. Very good. And then your deep cervical that's here in the middle. In the front, okay? Very good. Okay, Ms. Dora, can I get you to just shrug your shoulders for me? Okay. So this is gonna be your supraclavicular, okay, lymph nodes. Any tenderness?
No.
All right, Ms. Dora. So you can go ahead and relax your shoulders. So Ms. Dora, I'm just gonna step behind you, and I'm gonna assess your thyroids, okay? So I'm just assessing them. No tenderness.
No.
Okay. Place my fingers here. And can I get you to lean your head back into the side, to the right? Very good. Okay, go ahead and swallow for me. Very good. Go ahead and lean your head to the left. Tilt it back and swallow for me. Very good. Okay. And straighten up. Alrighty. Did you have any tenderness?
No.
Alright, Ms. Doris. So do you have any questions for me today?
No, I don't.
Alrighty. Well, that conducts our general survey, and I just want to thank you for your time, okay?
Thank you.
Alright, thank you. Have a good day.
You too.
So I'm going to begin my verbal report over my general survey. My patient is AAO times 3, AAO times 3, consumes a regular diet that consists of meat, fruits, and vegetables. BMI is 24, indicating a healthy range. Her posture was erect. Her gait was smooth and steady. She describes today's mood as happy and indicates this is normal for her. Her speech is clear and articulate. English is her primary language. She was dressed appropriately for the weather, and her clothing was nice and clean without no body odor. I then began my assessment of her cranium. Her cranium was smooth and non-tender. Her scalp was intact with no visible redness or flakiness. Her hair was dark brown, thin, and evenly distributed. Her eyes were symmetrical with no redness, swelling, or drainage discharge noted. Perla. Her nose was symmetrical with no redness, swelling, or discharge noted. Her sinuses were non-tender. Her ears were symmetrical with no redness, swelling, or discharge noted. Her lips were pink and moist, no cracks or lesions visible, and slight droopiness. Her neck was symmetrical with no visible pulsations. Her trachea was midline. Her lymph nodes were palpable and non-tender, and her thyroid is palpable and non-tender. And this concludes my verbal report for my general survey. Thank you.